Jennifer, we're really beginning to see get vaccinated or go home. Is it working?
I think it is. I mean, we're starting to see data, at least from certain workforces like the Defense Department, for instance, that after the mandates, the vaccination coverage increased quite a bit. We heard the story from United, and I think increasingly we're hearing stories of employers enacting the mandates. And, obviously a few people seem to leave in protest, but by and large, it seems to boost uptake among the employees. And I can understand why employers are doing this, because this is what they need in order to be able to operate safely and have their customers feel safe engaging with them. So, I think it's helping all around.
I saw a fancy paper to 3 digits that talked about death lagging cases by 8.536 days or whatever it is as well. Cases have again rolled over. Do you presume deaths will roll over?
I do. I do think we will see that. It's starting to plateau a bit, which, I think is a good sign. We typically, when I look at the data, I usually see about a 3-week delay, 3 or 4 weeks. And, the hospitalizations are starting to come down. That's usually what's next after cases and then deaths. But there are no guarantees. And, as soon as we change our behaviors, we decide to start doing things that we maybe thought were a little bit risky in the coming weeks, and people start to travel again, we could see cases go up. And in my mind, as long as people are vaccinated and we keep people out of the hospital and dying, that's really our goal. So it's not that we're never going to be able to do things again. It's let's figure out how to do them safely, and vaccines are the thickest layer of protection.
Dr. Nuzzo, we're coming from a different place, though. I mean, as we head into a potential another wave, if everybody releases some of the protocols that they've taken to prevent infection, there is a greater amount of immunity in the community. How much has this actually provided protection that perhaps is being discounted?
Oh, yeah, absolutely. There's 2 ways to get out of this pandemic, and they're both involved building immunity. One is to do that really safely with vaccines. Another way is to get the virus and to have a natural immunity, as people sometimes call it. That is, of course, the riskier path. But, national surveys looking at people's antibodies and vaccinations show, a much higher level of protection than I think we see just in the case numbers. I am glad to say that the surveys show that most of the protection is from vaccines, and that's really what we want to see. We don't want people to take risks for themselves by trying to go out and get the virus and build immunity. We have safe tools to do that.
What would you say to people who are still putting on 2 masks to go outside and who are petrified of re-engaging in society? There is a big cohort of these individuals. I know some of them, and there is this fear.
Let me rephrase this. There's
yes.
a big cohort of these individuals within the 6 blocks radius of Lisa Abramowitz's home.
Okay, it goes a little bit further, but my question, Dr. Nuzzo, is what would you say to them? How do you sort of parse this message of this is a real threat? You have to take precautions with you have to also live.
Yeah, so first of all, vaccines are protecting us from when we get infected with the virus, that we're not going to get severely ill. So if you absolutely want to make sure you do not get sick, you do not get a cold, you do not get infected, taking measures like wearing masks and avoiding certain spaces is the way to do that. This virus isn't going away. So, if that is your goal, at some point you're going to have to either just do that forever or change.
Yeah, but come on.
But I think in places where the virus is high, it makes a lot more sense. But if you're living somewhere where the cases are low, and also I think a lot of people are doing it in part because of vulnerable folks at home, like kids who are, too young to be vaccinated. So